o'clock. We will call the Sawyer County Lacutere Criminal Justice Coordinating Council meeting to order. Ms. Smith?
Thank you. All right, so we're gonna take roll call.
Roll call, yep. Kathy McCoy is excused. Gary Hilgendorf.
Here.
Mark Helwig.
Here.
Marshall Savitsky. Elaine Smith.
Here.
Katie Bellinger.
Here.
Ryan Reed. Reed Schumann.
Here.
Lorraine Gouget. Andy Alvarado. Excused. Bruce Paquette.
Here.
Doug Rotek.
Here.
Mike Waller.
Here.
John Yackel.
Here.
You have a quorum.
Yep, forum. It will stand for the pledge of
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Should be the certification.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Has everyone looked at the agenda?
I'll make a motion to approve. Mr. Chairwoman. Second.
Okay, the agenda is approved.
All those in favor?
You shouldn't have to run an agenda.
Any public comments? Do you have any?
We have no one online.
Okay. None. And the approval of the minutes from the previous meeting.
Make a motion to approve the previous meeting.
Thank you. I have a motion in a second.
Second.
Thank you. And then you took note of that, right? I don't have to call their names.
Correct. We just need the call for us
Uh,
agreement.
Okay, we have no nays, and so everybody in favor of approving the minutes from 1/11/23, say aye.
Aye.
Thank you. Been a long time since I did this.
Doing great.
I'm gonna leave number 8 and number 9 until after.
Oh, till later, okay.
That's what Kathy told me.
Okay.
So we're gonna go right to the jail report update.
And a new one was added, or that, the copy was added this morning, so it is on the screen if you would like to bring it up.
Madam Chair, I'd like to start off and point out, we did some changes here in our jail report on the demographics there. And any information that was on there before or any added information, we appreciate any input on what this committee and the public's looking for. One of the things we did take off the demographics of race and really want to focus on, and in the future, we're looking at employed and unemployed. And just for this committee's information as well, on our booking process, we asked if they're employed or not employed. And it's, you know, their responses in good faith and accepted as such, but going through a lot of them, it probably gives them the benefit of the doubt. We found that 80% are not employed from the inmates that we book in. And it's probably actually higher than that, but based on their information and good faith, we find that 80% are unemployed, and I think that's big. Because if we can get these people employed and trained and working forward in the community, I think focusing on getting them to be productive members of our society, I think that's really going to benefit us in reducing our jail recidivism.
A lot of the unemployment, though, it's been my experience anyway, that they'll have those mental health issues and addiction issues that go hand in hand, and so makes it hard for them to keep a job.
You're right. Yeah, and those are other issues with that, that if we can focus on, I think we, that seems to be the big common denominator, unemployment, addiction,
So
mental health.
is there a part of the demographics, I don't remember from the last time. Is there anything that talks about substance abuse issues or is there a
No.
check mark for that?
No.
I don't have any other comments. Anybody else have any other comments?
Of course, another big issue as far as unemployment goes. That if they have a criminal past, very, very difficult to get.
That also affects their housing, too, being unable to find housing. If they have a felony. Sometimes that hinders them as well.
Thank you.
Anybody else have any comments?
I guess I, as far as the jail report, we're still housing 21 inmates outside the county.
At the time this report was done, yes.
Okay.
This was done on the 25th of last month, I believe, yes.
Is that due to still a shortage of jail staff?
Female jail staff.
Yeah.
Our females are still being housed in Barron County. At this point, we don't have any males there, just females.
Correct.
Okay, the jail report update. Is accepted. Anybody want to make a motion? To approve?
Sure, I will. I'll make that motion. To accept the jail report.
Second,
Okay, the jail report update has been passed. All those in favor say aye.
Aye.
Any nays? No nays. Okay, pass. And then we have update on the criminal justice coordinator.
Okay, so as of February,
Becky, could you step up just for your report, that's all. That's okay.
so as of today, on free trial, we have 106 people. 36 of those are court reminders only. We have 11 on diversion. We also have 11 diversion cases pending. We have 15 people that have completed diversion. We have 29 that have been determined diversion eligible. We have 2 people that have failed out of diversion. 2 pending failed diversion cases. We have 36 people on our wait list and we have 7 pending intakes. We have started working on our wait list. So we're sending out wait list intake letters. What we do is we have a 10-day waiting period. If those people don't contact us, then we work our way down that wait list. We do only contact, if they haven't updated their address or phone number, those are the only contact information that we have to work on. If they haven't updated that, we don't have any other contact information to work off of. So it is part of their bond to keep that information updated. They are in violation of their bond if they don't update that. So we do update the court, but there isn't anything else we can do if they don't update that information. We also have a new treatment court coordinator. Heather Lassard is our new treatment court coordinator, which we're very happy about. That does leave us without a pretrial case manager. So we are hiring. We have submitted that job posting. So if anybody knows of anybody, please send them our way. We also have made some changes in our office and we have created a diversion coordinator position because we have increased our diversion cases. So Katie Ann is still doing pretrial case management, but she's also doing diversion coordination, which is a good thing for us. So also I want to make this group aware that Andy has asked that all of our treatment courts coordination go through this group. We have a treatment court work group that has been, we've met once and we're meeting again today. There is a lot of different things that are going to go through treatment court. And he has asked that this group, because by rights, this is our governing body. He has asked that this group approve everything. which is fine, but there's a lot of things that need to be approved. So this group needs to decide if they don't want that treatment court work group in place or not. Anybody in here that is a part of treatment court work group can attest to everything that has been sent to you so far, and I can send CJCC everything that needs to be approved. But I thought that we had discussed in CJCC at one point in time that there is a lot of things that need to be approved and that would be a burden on CJCC. And that sometimes we struggle with a quorum, especially now with this group growing. So I think that I would ask that this group decide if you want that work group to be in place or if you don't want that work group to be in place.
I guess I would have to ask, what does that work group entail?
Well,
So we could have
the-
better.
anything that's going to be done for treatment court, whether that be who's going to be on treatment court, what treatment court approves as far as policies and procedures, what is spent on treatment court, I mean, ultimately, this is our governing body. So if there's any major decisions, we'll bring it back here. But there's a lot of work that goes into treatment court.
Sounds like it's needed.
Yeah, it seems like it's kind of like, on the Healing to Wellness Court, we have a team. But then we have a steering committee that is composed of executive directors of the programs. And that's the body that approves like policies and procedures and things of that nature. And but the team is the one that decides on a bi-weekly basis on the, whether somebody's going to be admitted and what the progress is. And we have all the confidential information about the participant.
So the
It's
treatment
kind of
court
similar.
itself will be the one who determines who is admitted into treatment court.
Right.
But the treatment court work group is meant to help steer what actually happens with treatment court. And like CJCC will determine, when I submit the grant funding and all of those major decisions. But as far as the day-to-day happenings with treatment court, that would go through that treatment court work group.
But there are a lot of things in the initial phase that will come to this body for approval.
Correct. Sharon?
Madam Chair, Becky, with Justice Point having a history in being involved in this before, do you have a thought as far as what would probably work the best?
I really thought that having the work group in place would be the best. But when Andy called me last week, he said he didn't want any approvals to go through the work group. He would prefer it go through CJCC. I respect that. I just thought that it would be a burden to have everything goes through CJCC because one, we struggle with a quorum, and two, because it's sometimes there's a lot on CJCC, whereas the treatment court work group is more focused specifically on treatment court itself.
Madam Chair, I understand Andy's point, but I wish you'd have brought it to us before you brought it to her. So we could discuss that because of the fact that the work group is, to me, it sounds very, very important. And it sounds to me that they can make a lot of those decisions, a lot of the major ones maybe should come here, but I think it should, I don't know.
Did he direct you or did he ask you? Because I'm
Right.
just wondering, is there an option to not be that? It didn't sound like he gave much of an option for it to, you know what I mean?
I didn't know he wasn't going to be here today.
Oh,
I don't know if he gave me an option, but it's, the CJCC is our governing body. So it's up to the CJCC.
Right.
It's not up to me and it's not up to him.
More
It's
like
up to
an
the CJCC.
What if they make a recommendation, the treatment work group makes a recommendation to the CJCC for approval or not? That might be less cumbersome.
Correct.
But
Becky, how many members are you looking at to put on this work group?
we're already on.
And you have,
We already have it.
Yeah,
We've
we're already
met.
on.
you already have it?
We've met.
How many do you have on it? though?
There you are.
There, I believe is 17.
Pretty good size groups against themselves.
You have trouble getting a quorum with that many? On that work group?
No, I
Nope.
think-
Andy, he's just joining in now.
Ask him, he can explain his thoughts on
Is
that.
Andy-
Is he
is
on
he
yet?
there?
Andy. Andy, you out there? Andy?
But he's trying.
I know he's in Hawaii, so.
Oh.
It's a long way.
Okay, that's a-
I'm grateful that he's got
Yeah.
the black background
Andy,
up
can you
right.
hear us?
I think so.
Yeah, I can hear you now. Sorry.
Oh, there you go.
Andy, this is Elaine Smith, or discussing whether or not the treatment work group should bring everything to the CJCC level for approval, or if a recommendation from the treatment work group to the CJCC would be acceptable. And what are your thoughts on that?
Are you talking about the treatment court?
Yes,
Yeah, I think it would be good for the for Becky to bring her recommendations to the CJCC. I mean, I'm not sure which parts of the treatment court you're talking about, but I think the formation, who's gonna be a part of it, would be good to bring those to the CJCC for approval.
Hey, Andy, we're talking about I guess you talked to Becky about the work group that you want them to bring any issues to the court, to the CJCC, and have us make approvals on issues. We're just kind of curious what your thoughts were on that, I guess.
I guess I'm not understanding what types of issues they would bring to CJC, or what you're asking about.
So Andy, this is Becky. Last week when we talked, you had asked me to bring anything treatment court related to you as opposed to having the work group discuss issues. So I asked CJCC to discuss that because there are so many different things right now that are going into treatment court. And with CJCC so large and not always having a quorum, I wanted them to discuss whether it was practical to have a work group so that we're able to continue on doing what we're doing with treatment court work group, or if they wanted us to bring everything that we're doing with treatment court directly to CJCC.
Oh, I think if CJCC is okay with the work group handling it, then that's fine, but for me.
Okay,
I had thought that the last time we talked about the work group, I thought that it was an acceptable process. And I can't remember exactly the date of that meeting that it was talked about.
we meet the same days that CJCC meets.
But I mean, when you talked about creating the treatment work group,
Okay,
I thought that there was a general feeling that that was a good idea. to
and
have.
that was my understanding too, until last week when Andy and I talked. So I just wanted to put it out there again to make sure that CJCC approved it.
Okay. So, Andy, do you feel like you want us to take a vote again at this level about the formation of the treatment work group, or?
No, I guess I just wanted to make sure that CJCC knew who the work group is and is the work group who will actually be working with the hearing the treatment court cases and working with the participants? Or is that
I-
different?
It's my understanding that it's different. That it's going to be the coordinator who's going to be working hands-on with the and the case manager with the participant. And the treatment work group was starting out with like the policies and procedures and things of that nature.
That's correct. That's
Okay.
correct, then, yes. So because our first year is our implementation period, we're just getting things set up. So the work group is getting things set up for treatment court.
Got it.
Okay. No, I think as long as CJCC is understands that there's a work group that's going to be doing that work and it's all right with that, then that's fine.
When is that meeting scheduled?
Today,
At what time?
1:00.
1:00.
Okay, we should get those on the calendar because otherwise things get booked in here. And I
We
don't
talked
see it.
about that and you told me that this room is booked, so we're meeting in the jail classroom.
Okay, is it always every week the same, or every month the same day? Okay,
Correct.
we need to.
We'll look.
So Becky, what is the language you're looking for here then? I think we're all in consensus that we're gonna have the treatment court work group handle the day-to-day and make some decisions. So that they don't have to wait for all of us to meet and slow you down.
It sounds like that, as long as I'm not a member, so I'm waiting
Oh.
for approval from.
Sure. Well, I'll make that motion that we approve that treatment court work group to address the day-to-day and the setup of our treatment court.
And
Good.
then they'll bring the recommendations to this body.
Correct.
Second.
Okay, so we have a motion and a second. Everybody in agreement, say aye.
Aye.
Any nays? All right, the motion passes. So I think we're okay with that then. Let's see. Now the TAD grant, that was all covered under the diversion and treatment for update. So now we have a report from Health and Human Services.
I don't know if youth justice or mental health sent anything, you then. Okay. I'll just update from public health perspective on what we've got going on. Non-opioid related, actually. We already do some STD testing in the jail for trich, gonorrhea, and chlamydia. And we will be adding syphilis testing and treatment as something that we should be able to get up and running probably by March 1st. It's looking like, so we've been talking about this for a couple of months. And we'll also be able to, we'll make sure we message that we can do hepatitis C and HIV testing once they get out of jail. We'll make sure that we're available for that. The other pieces that we have going on is we just applied for the Narcan grant so that we can have the Narcan and be able to do training, community training. And we did talk about that last week or last month, actually, when I went over that gap analysis and recommendations. And so the grant came up, so we've applied for that. So we're going to be focused on community training as we move forward with that. Hopefully we get that. The other thing that we know is coming down the pike is fentanyl test strips. There'll probably be a grant for that. So we'll be working with some other counties that already have that in place with their policies and procedures and apply for that when we get that. The other thing that we noted was we were looking at some grants and your prevention and substance misuse coalitions. We really need to beef that up, make sure that we have better sectors represented. We're just starting to merge in with LCO's Prevention Coalition. Sawyer County had one, LCO had one. It does not make sense that we're not working together. So we've been starting to meet, have conversations. So really, when we look at our goal planning, it will be we're going to look at this one grant that came through. It's highly competitive. It was $125,000 for a year. We're really not in a good place this year for applying for it. But what we're going to do is take a look at that grant put all the pieces in there, identify where we really need to beef things up so that next year when these grants come around, we're ready to go for the application process. So that is where we are, and we'll just keep watching. More and more money is getting released to the state from the opioid settlement. So that'll be coming through. We also know that our next settlement release should be, I think, needing to be signed by March by the county board. So, and that's looking at like it's about equal to what we had already received. So, so as we watch through, those will be coming through. There's also additional things when we look at the settlement. There's one other one that will be coming through hopefully within the next year. And then there's also another pot of money with the settlement. It's the ones that went bankrupt, and then that money went into another pot, and I'm not sure when that's going to get distributed. So it's looking like there'll be 4 different pots of money from the settlement funds. The benefit to that is what they're doing with the settlement funding is that 85% of it has to be spent on actual opioid work, can't be spent on anything else. If we decided to take that settlement where we got our lump sum right away, that would potentially reduce us so that we weren't spending 85% on the work that we need to do. So what they're looking at is being able to look at which settlements we want to just roll out and get paid over time, and which settlements we're going to want to try to take that lump sum payment and get the money up front on. So that's going to be something that they'll be looking at. WCA is really doing a lot of investigation into this and will make recommendations to the counties. So that was the last thing that I had gotten updated on when I went to the opioid conference in January. And then I can go in, it's probably running into overdose planning. With the other thing that we talked about was really getting an idea of where our data lands on overdoses and fatalities. And so we've been reaching out to EMS, the medical examiner, been working with the state on data, and then we're reaching out to the ER so that we can be able to get that information directly and timely, be able to understand where we're at. For the overdose fatality review team, that's something that we don't have set up. We were working with the state to see how we could get hooked into that. Apparently, there's grants with that, so we can't really get hooked right into the system. So we're going to kind of figure out where we're at when we start seeing our data, see what we can do kind of on the back end. And then when the grant system comes up and allows us to get back into that system, the state has put us on a waiting list. So that's my update. Any questions?
When are you going to get an answer on your Narcan?
We're hoping like within a month or so. It should not be a long process for us to find out.
Should probably get it. I hope.
I would think we should get it.
Yeah.
So Julia, you said there's 4 pots of money,
Yes.
right? And do we decide how that money comes with each pot you're talking about?
Yeah, so the county board will decide, yep, how that money will come in. So whether you're taking it as those payments out. I know we've already received a pot of money, so different off of each of these settlements, there's a number of payers into it, and like they've decided what time frame that they're going to be able to make those payments to the system on. So
And if you take a
Andy's
lump
got a
sum right up
spreadsheet.
front, you're gonna get less.
If you get a lump
Correct.
sum up front, you're gonna get less,
Yeah.
and you're potentially not spending 85%
Right.
on what we need to spend it
And
on.
it's over how many years?
They
Maybe you can.
all vary. They all vary. I think 38 is the longest time out. Seems like a long.
Andy, what's the total amount of
Yeah,
opioid
Andy.
funds that are headed our way?
Gotta think.
Potentially.
That number, I can't give you a current number. I mean, the initial number from the distributor settlement, I believe is 400,000-ish, but that number is moved. What Julia's talking about, the 4 pots of money now, we'll be getting documents to go to the county board maybe this month, more likely March, for the retailer settlement. That's the Walmarts and the Walgreens and those that have settled. That's going to be additional money on top of the original 400,000, probably about 80%. So 320,000 more. Yeah, and then there's still the manufacturers, and the fourth pot is the ones that have gone bankrupt. So we don't have an exact dollar amount. We'll get an updated dollar amount when we get the settlement paperwork for the retailers. The conversation about taking a lump sum payment has cooled off. So the county association isn't even pushing that forward right now until they determine if, because like Julie said, if you take a lump sum, you might not meet the criteria for spending 85% of it on prevention and treatment. So that option's not available at this time, but if it is, it'll come back to the county board to make that decision.
And Andy, we've already received what, 40-some thousand?
No, we're over, one of the distributors paid ahead. So we have, I'll say 120,000 in the account right now.
Madam Chair.
Yes.
So are we the governing body that is deciding how that money is being used?
I think it's the county board.
County board is?
The county board has kind of delegated CJCC to come up with recommendations.
Okay, that was
Yeah.
my,
We'll make
Thank you.
recommendations at this level.
Yep.
When's the next county board meeting? So-
Well, a special
And we're
tomorrow
working
or next Thursday.
for recommendations.
thank you.
I think one of the next steps is for the plan that Julia presented last month. We're going to put that on the board agenda for this month, so the full board can see a presentation. But it would be to put a work plan together for that and put a budget together to implement it.
Anybody else have any other questions? Okay, all right. So do we all accept? I need a motion, I guess, to accept the report for the Health and Human Services report as well as the overdose planning report.
I make a motion to accept those reports from Health
Second.
and Services.
Judge got a second.
Wait a second.
Not a second.
Okay. All in agreement?
Aye.
Any nays? Okay, the reports are
Can I ask
approved.
Julia one last question first? Julia, are all the overdose deaths related to opioids? So there's no cocaine, meth, nothing else involved with the deaths, it's all
So-
opioids.
Really, what we can see in the data right now, because we haven't been able to dive into every one of the cases, but the general data that we have from the state is it's really fentanyl related, so synthetic. Synthetic.
I have another question on that fentanyl, sorry. You said that there was like fentanyl testing?
There's fentanyl test strips that are available, so, and I'm not as familiar with that, so we'll be looking at that program. One of the things that we have been hearing is people who think that they're just, smoking THC and they're going in and getting drug tested and they're finding out they're having a lot of other things in their body and they're saying, no, I didn't do anything else, so everything is getting laced. So that's really where that would be.
Thank you.
It's a harm reduction strategy initiative that the state's pushing out, because the whole idea behind it is if the addicts are going to use anyway, but they can test their drugs and see that there's fentanyl within, we can try to prevent these overdose deaths as a result. If they can see that fentanyl is in the drugs that they're using, if that makes sense.
Yeah.
So that's where the harm reduction piece of that comes in. This state through the Department of Corrections is also pushing out the initiative, and we have that presently available in some of the DOC offices. To provide to clients. You know, we're not promoting their using, but we do also understand that, you know, we weren't born yesterday and there is going to be use that happens, and we'd rather them alive than dead, you know, so that we can continue to try to work through that process and get them the help they need.
Right, I guess that's where I was curious if the individual, they would test what they're using if it's got fentanyl, and that's what you're saying.
Yeah.
Okay, thank you very much.
All right. Next is the report on possible state funding for housing by Katie Ballinger.
So this is Stephanie Nault. She is our, what is your title? Purchase good
program and policy analyst.
It's a long one.
Yeah, the title doesn't matter. I can introduce myself. So Stephanie Knowles, I work with the State Department of Corrections. Actually, historically, I've been an agent. I've also worked as a supervisor, and now I took on this role. More or less, I oversee the Region 6 budget, which is kind of the northeast corner of the state. I oversee the budget in terms of all the housing and treatment programming that the Department of Corrections funds to our Department of Corrections clients. So kind of why Katie invited me to come here today is she's been talking about, and of course, in my role, I could see the gap in resources, especially in terms of housing in this area. And when I talk about housing, I'm sure there's gaps in housing in a lot of different areas and with populations, but specific to the Department of Corrections population, we see a gap in housing for the homeless clients that we have, especially those in kind of that reentry phase. So coming out of jail, coming out of prison, the reentry phase coming out of like inpatient treatment setting and coming back into the community. Also individuals who just have an unstable home environment. The idea is, where do they go? And I know you kind of mentioned this earlier on, like we're trying to make productive members of society, we're trying to reduce recidivism, but bottom line is if their basic needs aren't even being met, it's really hard to work up from there, right? And so ultimately housing being one essential basic need that has to be met for these clients, or, you know, they're kind of in that crisis state. And so, or that's ultimately a lot of times mentally where they go to when they're homeless and when they don't know where they're going to sleep at night. And so I guess I come to you today just to kind of learn a little bit more about maybe what's available in the community, or for people just to hear that, you know, ultimately we do have a cry for housing in this area, and the state does have a budget to help support that. So through the Department of Corrections in all of our counties, we have housing opportunities that are available for our clients. And I'll say Hayward, and we have one additional county, are the only two counties where we really struggle right now that we don't have housing. And when I talk about housing, like there's various levels. We have what we call emergency housing, which is the motels and hotels that we can house individuals in. We have funding for that. We're actually struggling right now in this area to even find a motel that will house our clients. Katie can attest to that. I don't think we have one. And so the ones that we've utilized in the past, either they got sick of housing clients, they, you know, ultimately you're talking about sometimes sex offenders. And so they don't want sex offenders on their property because it's deterring other clients from wanting to stay then at the motel or the hotel. And so, you know, there's a lot of, I guess, kind of cards against us as a result. So that would be specific to emergency housing. There's other levels of housing too that we have in other communities. Some of those are called, we call them, they used to be called TLPs, which is like a temporary living placement, which is more or less like an apartment that we pay rent for our individuals to be housed at. And so there's a couple different levels of those apartments that we can fund. At the one level, it's kind of a lower level where we pay the landlord monthly rent. We're able to house our clients there. And then ultimately just on a regular weekly basis, DOC staff, so the agents, kind of pop in and out of that facility just to ensure that things are kosher and that clients are, you know, keeping the place clean, that sort of thing. We also have another level of placement that's called these temporary living placements, which is a monitored kind of apartment facility. And so ultimately we would contract with a landlord or a contractor who contracts with the landlord of these buildings. And typically they're 2, 3, 4 plus bedroom unit that we're contracting all the rooms for, and it's for our clients to stay there. And then there's also regular checkers that come and go to that facility. So you're talking checkers coming and going about 3 times a day. And then also law enforcement having the ability in all these cases to know where we're contracting with and where these clients supposedly are. So just, you know, throwing out those as possible opportunities within the community where we could house individuals. However, if we don't have landlords that are willing to rent to us, if we don't have these motels or hotels that are willing to rent to us, you know, we're kind of at a loss. The thing that I can say from the budget perspective with the Department of Corrections is we don't want our clients homeless, right? We want to know where they are. We feel that the community is safer when we know where our clients are versus walking around in the streets or just not knowing where they're staying and not having that stability factor met. Like I kind of indicated, we also want to be able to case manage with them and help them in other areas of their life. And we can't do that if they don't have that kind of stable foundation of especially housing. And so in all these cases, these are temporary fixes, but it gives us a time frame. So minus the hotels and motels, if we were able to establish one of these apartments, let's say that was contracted through the state, individuals can stay there up to 90 to 120 days to try to get their feet under them, to try to get them stable in terms of mental health and sobriety, which we talked about earlier. And then ultimately trying to get them a job so that they can afford, their own housing. And so that's the basic goal of it. The basic goal is that this is a temporary place for them to stay until, again, they can become stable, they can get that job, and they can move on and be stable, productive members of society on their own. So I guess I just like to put it out there, I expressed some of the generalizations of why we don't want these individuals homeless. And the bottom line is right now in this community, we oftentimes have these clients coming out of jail or prison. We have sex offenders, we have drug addicts, we have just individuals who are homeless because of other instability factors, and they are homeless on these streets, and it is concerning. And so, I just put it out there for food for thought. If there's questions, let me know. If there's suggestions or ideas in terms of places, if anybody has connections to landlords that they think might be out there and willing, I could say it's guaranteed money through the state. It's something that, we submit payment each month without delay. And I guess ultimately, you're part of trying to help some of these higher risk individuals in the community by keeping the community safe, and then just helping to promote second chances for individuals that are struggling. So those are kind of the arguments that I can make for this clientele and this population.
I think that housing is a problem, not only on the reservation, but in the community and here also. There's just not enough, and prices have gone up. But with our Healing to Wellness Court, people are walking that sobriety path, and we have a very difficult time finding housing for them, for sober housing. And what ends up happening sometimes is then they go to couch surf, and usually it's people who are using, and so they're right back where they started from. So that is a big problem, and you may have more insight.
Yeah. Does the Department of Corrections have money to build such a facility? And or Julia, could we use some of our opioid money? Would that be acceptable to build a facility to house these people? To meet their most basic needs so they can move up from there?
I think housing was on that. That's in settlement E, or that's in appendix E. I'll bring that. I'll look at that.
So I would definitely say
Yeah.
the State Department of Corrections doesn't typically build the facilities. There is oftentimes grant funding that comes down. There's actually one through DHS right now, up to $5 million for a brick and mortar grant that is specific. It's specific to OUD, SUD though, disorder. And so that has to be the specific focus around it. And a lot of times when you see these grants come down, there is that specific focus. Whereas like the Department of Corrections, you do need the building, the existing building. But then ultimately there's not, then we don't say who can or cannot live there, except that they have to be Department of Corrections clients, right? And so they don't just have to have an OUD, SUD diagnosis, or they can be struggling in many fashions, and just homelessness is good enough for us. So yeah, but unfortunately, you bring up a good point. It'd be nice if we did have that money to be able to fund projects like that. Like I said, at other levels throughout the state, there are, if you keep your eyes open to some of those grants sometimes coming through, but we don't, I don't know that the state's ever funded for a new bill. So
Do you want to add anything, Mr. Hildendorf?
yeah.
Well, that's what our men's house here is. But we have a limited capability of only 4 people, and one of the things we can't house are sex offenders because of our proximity to the schools. And so, and we had looked at the house right next to corrections there, but it was a lot of money to fix that house, and we didn't have, if we'd have known that there's this kind of money available, that would have made a whole world, because I think we have a board that would be very willing to work on that. In fact, Mike is next up here with this very thing about a homeless shelter and having people to work together to get a place for people to go, because it is huge. I just had someone, the motel, I had to talk them into having somebody, and it was only for 2 nights. And the reason why the motels won't have them is because they get their rooms torn up, they get all kinds of junk, and they're just tired of it. And so it is a huge problem, but if there is money available, I think we could put together a team to get some housing around here. And then I know we had a place, but I think that place got sold. That was available, and I thought was a very good option, but again, money talks.
And I'll say, you know, I would be happy to sit in on a team too, if we're talking, partnering with the Department of Corrections. That way I can kind of offer insight as to what we can do in that sort of thing. The department can provide, in some cases, like upfront money, if it means for, like you're indicating, fixing up the building itself. Sometimes that is a possibility. You know, it would be, we'd have to work with our business office on it, but ultimately, if it's determined to be a need and a gap in services, we can certainly make that argument. And I'm here to advocate for that. You know, I can see there's a need. I can see certainly there's a gap in services. And so it's something that I can argue at our state level so that we can try to get that funding down here and we can try to get something in place. So.
You got a card?
Don't, they have to give me the object.
Oh, okay.
So but I'll get you my information.
Okay. All right.
Oh, Katie.
We have, Sharon wants to say.
I would just like to add too, so the committee's aware, and Katie and I have communicated a lot when it comes to homeless, and the biggest challenge we have is sex offender. That is huge, and when you're dealing with those sex offenders, as Gary mentioned, they won't accept the sex offenders, and then you deal with community perception issues. They don't want those sex offenders to live by them.
Yeah.
And that has really been a challenge. When they're convicted in Sawyer County, there's an expectation at the state level that they're placed in the county they're convicted in. So we are, for the lack of a better word, stuck with those people to try to find them housing, and then to find them housing in an area that's acceptable to the public or the community where they're going to be living is that huge hurdle.
And you know, even through the state, like we have sex offender specialists who go around to different communities and speak to communities on that behalf to try to educate, you know, communities on understanding, like, these sex offenders are here and they're living here regardless, right? And so at least if we can know where they're living, at least then we can try to monitor it a little bit closer. At least then they can keep their GPS units charged so that we know where they're staying. I mean, if we have these sex offenders, they're homeless on the streets, they aren't keeping their units charged. We don't know where they are. Law enforcement can't really monitor them except to see them walk in the streets, you know, throughout the night, that type of a thing. But it's just not safe. And I totally understand, you know, everybody wants their community safe, and the perception around, especially sex offenders. I get it. You know, I have young kids too, and I have the same mentality at times, but at the same time, I'd rather know where they are, you know, and I'd rather know that there's supervision over that. And I'd rather know that sort of thing, because I know then the community is safer because of that. So, you know, but like I say, I mean, if that is a hurdle that we have to learn to, you know, try to overcome at the community level, we can certainly come and speak, you know, on behalf of the community at any point in time too, and talk about those things. So.
All right, thank you. Anybody else have any comments that they want to make or questions? Anybody want to make a motion to accept the report?
So moved.
We have a second?
Second.
All right. All in favor?
Aye.
Any nays? No. All right, we're gonna move on. Kind of similar subject. We're gonna hear from Mike Thompson on the homeless shelter.
Thank you for having me. I'm Mike Thompson, the executive director of the House of Hope across the street, and I know many of you and have had interactions. And by the way, if anyone's interested in going to our annual banquet on March 9th, see me afterwards or talk to Gary. You can see what we do and hear the progress reports from guys who've gone through the program. Dr. Grant has a lot to say about that too. We are looking at, actually, let me strike that. I am looking at being willing to lead a task force or group or team to help do something about the homelessness situation that we see. We have a lot of people who come to the House of Hope, probably some weeks it's 3 to 5 people a week I have to turn away because they don't qualify for one reason or another. Some of them just want housing, they don't want a program. I don't have any personal animus about that. But some aren't ready. You know, they have defense mechanisms and other things that prevent them from looking too deeply. But I really have in my mind a picture of people coming into a house where they can stay and they can work on some just basic self-awareness and be introduced to some things that would maybe prepare them for the House of Hope or for other rehab programs. You know, what I would like to see is I'd like to get together a task force of about 5 people and work with other sectors that are represented here and elsewhere you may know about. It was very interesting, the timing of your presentation. We will be in touch. I would like to guarantee that. So we need people who understand more than I do about grants, housing issues, interagency cooperation. We need admin people because I'll go blind if I try to do admin stuff too much. So as I said, I'm willing to pull together a team. And I would imagine a nonprofit would probably be the best way to do this. But I think there's ways that we can collaborate in ways that the House of Hope can't because of our structure and programs. You know, there isn't a lot of availability in the House of Hope for granting and for other things. There could be here because I think the interest is mutual. And I don't think the funds will be precluded from maybe assisting or we'll raise funds or we got to do something. I can't turn away 5 people in a week and have a clear conscience about that. We just have to do something. So anyway, I just want to put it before you that if you're interested in being on a task force that may turn into a nonprofit, or it doesn't have to be a nonprofit, but something to get this moving. And so I just wanted to get that in front of you and let you know that this is something I'm going to be working pretty hard on. I do have an upcoming surgery, so as soon as that one's done, I just had knee replacement a few weeks ago. So when the final surgery is done, I'll be hitting the ground, not running, but walking as quickly as I can. So I'm probably looking at late March or May to get something going. So with that, it's in front of you. If any of you want to be in contact, I've got cards. Are there any suggestions or information that you would want to throw out or any way you want to advise me?
Well, Mike, I think for sure you need to include the tribe. We have 3 shelters. And we struggle with them, same situation you have. They show up, they don't qualify, they don't want to abide by any rules, so they have to turn them away. And it's terrible like that. And then where do they go?
Yeah, it's hard to see.
Wherever. So I think we need to have a tribal rep because we're running into the same things.
That would be wonderful.
We're trying to develop one of the shelters into just a drop-in, like soup kitchen, cot or whatever for the night. Yeah, you have to check out every day.
Right.
For people that aren't ready.
Right.
But
we're looking at the same approach, but the team may have something to say. But I'm thinking like a warming house approach where you don't stay there all day and throw all your stuff in a corner and you pile it up.
Yeah.
Okay, thank you.
Thank you, sir.
Thank you, Mike.
Trying to move us along here. Community services update. None? Anybody have any future agenda items? Would like to hear. Okay.
Certainly want to hear more about Katie and her. I can't think of your name right now.
Stephanie.
Stephanie. And how we can get that funding.
So do you want
Apartments.
DOC to come back on the reentry program? So
Yeah, or Katie, yep. Keep us on
Katie
track
and-
where that's going.
Well, I
Katie and
think,
Stephanie.
I don't know that they'll be, and you can jump in if I'm incorrect, I don't know that our update or our information will change. Like we need a building, really, you know, I mean, the funding is there. I'm not sure unless, I mean, I'll always provide an update if we found anything or landlord has worked with us.
Okay.
But I would also ask that if anybody knows of anybody or any, landlords that would be willing to have a discussion at least. And that's something Stephanie and I could do.
And we can also look to be a part of this task force team to see how we can partner in that initiative. And even if we can fund some of the beds at the facility to help with the costs, if it's something that's open to other individuals in the community, not just Department of Corrections residents, that's okay. We can fund our portion and it's, whether the county or whatever to other type of grant funding they find to support the other portion of the initiative. That's a possibility. So.
Okay, thank you.
Mhm.
All right, now.
And then just weird, can I just say, I'm sorry, real quick. Since her cards are outdated, I'll just email her information to everybody on the email or to Lynn, so you guys have it.
Thank you. And we're gonna go back to number 8. Mr. Hilgensdorf, I understand that you were resigning from this wonderful
He's
board.
rescinding.
He's rescinding his resigning.
Yeah. Exactly.
No, in fact, I want to resign and Kathy and Mark on the way out last time, you guys talked me into staying until we found a replacement and they'd mentioned Grant. And I was excited that they'd mentioned Grant and I asked him if he'd be interested in serving on this committee because he is exactly what we want in this community. Grant went through the program and he's been out, in 2 years now? Yeah, he's been out 2 years and he is working in our community. He's very active. He is doing everything right. And that's what we need to see. In fact, I think he was asked to come here because we need some encouragement because there's so much negative. And he is an example and he wants to serve in this commission. If you guys would take him in, and I would sure hope so, because he's the example of what can be done and that we can see successful re-entry into society with no one going back to jail. And we all know that even with help, sometimes they slip and fall, but Grant has maintained his sobriety and has done a tremendous job. He's very active in the House of Hope. He's active at the at our church. He's serving and he's just a great part of our community and his employer is supportive of him. So that's.
Now, do we have to take formal action to accept your resignation or?
Yeah, I think
acknowledge
so.
it?
Yes.
We
Yeah, I
have to
think.
take formal action. All right.
So I am formally resigning.
We're sorry to hear you go.
I got plenty of other things.
I will not make that motion.
Oh, no.
I'll make the motion, knowing that we greatly appreciate everything Gary's done for us.
Amen. I'll second it.
We have a motion and a second. All in favor?
Aye.
But I will make the motion to appoint Gary Gerber in place of.
Grant.
It's Grant.
Gary's my uncle.
Grant to replace Gary.
We have a motion to accept Grant Gerber, second. Judge did. Okay, we have a second. All in favor?
Aye.
Any nays? Right. So you are
Appreciate it.
now
Yeah,
our
welcome.
CJCC
Yeah.
group.
Thank you.
Welcome.
Thank you. I appreciate it and look forward to be able to help as much as I can.
And I'll need you to stay, so I can get your contact information.
Gladly.
And if I think we went through everything, right? We don't have any reports. There's a Wisconsin Association of Drug Court Professionals Conference coming up in April. Down in Wisconsin, Dallas, if anybody wants to go. I'm going, are you going? I'm going, okay. It's a pretty big conference, just 2 days, if anybody wants to go. All right, nothing further. We are adjourned right on the dot.
Oh, perfect.